Sure. So coming down is Wesley Tucker. Wes is a great colleague that many of us have been working with. He is a professor in nutritional sciences. I know I just elevated him in his promotion up to professor, but I see him that way. He has been at Texas Women's University for many years, and then he got recruited to the University of Alabama. But we're working and keeping our partnerships with him. So trying to keep him back in the Houston as much as we can area. And we thought, we have had a lot of discussions about diet and nutrition when it comes to stroke care, but we thought another area that would be really important is to talk about supplements and vitamins. Wes, thank you.
All right. Well, thank you. First of all, thank you for the invitation to speak today. I don't know if it was intentional to put me between the nutrition person between you guys and lunch, so I apologize in advance. I think I only have 18 slides, so I should get through this pretty quickly, usually about 20 minutes or so. So, as Dr. Savitz mentioned, I am faculty in the Department of Nutrition Sciences at the University of Alabama at Birmingham. My primary interests are the role of diet and exercise as it pertains to hypertension and then stroke. I'm also interested in heart failure as well. But the kind of focus of the talk today is obviously going to be more focusing on supplements on the market, and then focusing basically on the best available evidence out there for which vitamins and supplements actually work and which ones are just kind of hype. Because, we've had several speakers today mention social media. Obviously, there's a lot of influencers out there now, so it's really hard to know what is real and what is kind of hype. So we'll go through each of those. Okay, so here's just a quick roadmap for the talk today. So first, we'll put supplements into the broader context of evidence-based stroke prevention. So like, how do these vitamins and supplements really compare to, evidence-based lifestyle and medical, kind of therapies? Then we'll go into we'll look at some of the different supplements that patients typically ask about, like multivitamins, fish oil, magnesium, vitamin D, B vitamins, folic acid. So these are some of the supplements that you typically get the most questions about. And then we'll also quickly just go over some of the herbal supplements like, ginkgo biloba, turmeric, and garlic, and that sort of stuff. We'll just quickly skim over those as well. And then one thing that, Dr. Savitz and I talk about a lot as well is, what's interesting is there seems to be some, interest, or there's a lot of interest, and there's some preliminary efficacy in the space of brain health as it pertains to supplements and vitamins. So there might be some potential in that space, more so actually than probably the stroke prevention space. So we'll talk about that as well. And then finally, I try to make this talk as practical as possible for patients who may be in the room, or for physicians that are giving advice to patients. So we'll give some practical recommendations on when supplementation may be appropriate and when it may not be appropriate. So, I think it's just important to kind of start with a quick overview of kind of the hierarchy of evidence as it pertains to stroke prevention. So at the top, when you think of the hierarchy of evidence for reducing the risk of stroke, we think of, kind of AHA's, essential 8. That is where the best scientific evidence is. When you think of like blood pressure control, healthy diet, being physically active, smoking cessation, and then controlling those cardiovascular disease risk factors. And then at the bottom of the pyramid, you can see that when you compare vitamins and dietary supplements to those kind of well-established or scientifically backed approaches, the evidence is typically not as good, what's weaker. So supplements should complement but not replace, evidence-based lifestyle and medical therapy. And towards the end of the talk, I'm actually going to show you some data from adherence to different dietary patterns and physical activity, just to show you that, it's not all doom and gloom when it comes to nutrition. There actually is some really good science as to what actually works in this space. So, let's start with multivitamins. It's probably the most commonly used dietary supplement. So most people take them, to fill nutritional gaps, support overall health, or there's kind of this, kind of idea of it provides nutritional insurance, or kind of it's a blanket to kind of fill in some of the gaps. So what does the kind of evidence, the scientific evidence, actually show when it comes to large randomized controlled trials for the primary prevention of stroke? Well, unfortunately, there's no meaningfully, strong randomized control trial data that shows that taking a daily multivitamin actually reduces your risk of having a stroke. Now, it does differ when it comes to brain health and cognition. There's been some really good studies over the last 5 to 10 years, large randomized control trials that have actually shown some benefit there, may improve global cognition, one being the Cosmos trial. So we'll talk about that a little bit later in the talk, but just wanted to kind of highlight that for a lot of these supplements, you may not see a benefit for reduction in stroke risk, but you may actually see a moderate improvement in cognition as it pertains to different supplements. So just multivitamins are not recommended solely for stroke prevention. That's kind of the take-home message here based on clinical trial data. Now, before we discuss fish oil supplements, because that is obviously a very popular supplement as it pertains to both stroke and cardiovascular disease or myocardial infarction, it's important to recognize that individuals with higher baseline omega-3 blood levels, most likely reflecting greater habitual fish intake, typically have been shown to have a lower risk of ischemic stroke. So what the supplement companies will do, particularly the fish oil companies, is what they'll do is they'll use data like this. So this is observational data that shows that, oh, people who have higher omega-3 levels in the blood have a lower risk of ischemic stroke. And so they'll use this as kind of a claim to back up the fact that you should be taking fish oil daily to reduce the risk of stroke. However, this actually reflects the fact that people eat more fish at baseline, not really that, taking the fish oil supplement was specifically driving, the reduction in risk over time. Now, let's answer a question patients, are really asking. So if higher blood omega-3 levels are associated with lower stroke risk, does taking a fish oil supplement actually provide the same benefit? And I kind of hinted at it already. Overall, the answer is no. Larger randomized control trials typically don't show that your typical over-the-counter fish oil supplements reduce the risk of stroke. And I say over-the-counter because there is one kind of important exception here. A lot of you may have heard of it. So the Reduce It trial used something called Vascepa, which is a modified or prescription EPA, which I actually don't consider to be a supplement. It's more of a drug, in my opinion. So obviously there was really good benefit in terms of reduction in cardiovascular events in the Reduce It trial. But again, this is very different to an over-the-counter fish oil that you would buy from a drugstore. So typically when you're buying a fish oil supplement, they're going to come in a dosage of around 1 gram, okay? Vascepa obviously is a much higher dosage, and it's a modified EPA. So it's a very different supplement / drug than you're going to just typically buy on Amazon or in the drugstore. So routine over-the-counter fish oil supplements are typically not recommended solely for stroke prevention. So vitamin D is another supplement that patients, commonly ask about. Beyond bone health, it's also frequently promoted for cardiovascular health and immune function. Obviously, it got a lot of attention during COVID with obviously the immune kind of aspects of taking vitamin D. Observational studies have consistently shown that people with lower vitamin D levels tend to have a higher risk of stroke. However, randomized controlled trials have not demonstrated that routine vitamin D supplementation prevents stroke in the general population. And we actually have a lot of data on this. And it comes from the data in kind of postmenopausal women who are taking calcium and vitamin D supplements. So when you look at that, literature pretty closely, you'll see that typically you do not see a reduced risk of ischemic stroke or other types of stroke with vitamin D supplementation. Now, that doesn't mean that vitamin D isn't important. That's one thing I want to say today. Vitamin D deficiency should absolutely be identified and treated for overall health, particularly for bone and muscle health. But based on current evidence, routine supplementation doesn't, show that it reduces the risk of stroke. So another, supplement that we get asked about a lot, and obviously this has been popularized a lot recently because of Andrew Huberman, the influencer, and particularly for sleep. But for a long time now, there's obviously been a lot of attention for magnesium, specifically for its role in vascular function and blood pressure regulation, and now obviously more recently, the focus on sleep. So several randomized trials and meta-analyses have basically shown that you do get modest reductions in blood pressure with magnesium supplementation. in patients with hypertension or those who have low magnesium intake or have low magnesium levels in their blood at baseline. However, this brings us back to this kind of important concept we discussed earlier. Improving a cardiovascular disease risk factor does not necessarily translate into fewer strokes, unfortunately. So you have to actually look at the actual events to determine whether or not something works for reduction of stroke. So magnesium may modestly lower blood pressure, but it is not recommended solely for stroke prevention. Now, unlike the supplements, this is where it actually becomes a lot more interesting, a lot more nuanced. Unlike the supplements we've discussed so far, folic acid is one of the few that actually has demonstrated a reduction in stroke events. So if you look at this meta-analysis that I'm showing you on the slide, which includes data from 21 randomized controlled trials, over 115,000 participants, folic acid supplementation did show a reduction of about 10% for stroke risk over time in randomized controlled trials. Now, does this mean that we should, recommend folic acid or B complex vitamins to all of our patients? Well, unfortunately, this is where the nuance comes in, most of the trials showing benefit were conducted in countries without mandatory folic acid fortification. Yeah, so in those populations, folate deficiency and elevated homocysteine levels were much more common, so supplementation corrected a meaningful nutritional gap. So in the US, we've been fortifying with folic acid since about the late 90s to prevent neural tube defects. And so it actually has had a beneficial or a positive effect on stroke occurrence as well. So in the US, when you look at just studies that have been done in the US, this relationship unfortunately goes away. So while folic acid clearly has a role in preventing deficiency and remains essential in other settings such as pregnancy, the current evidence does not support using supplementation for stroke prevention in the general US population. In other countries where there isn't fortification, there's absolutely may be indicated though. Okay, so what about herbal supplements? So this is the last group of supplements I'm going to talk about as it pertains to stroke prevention. We do get quite a bit of questions about ginkgo, turmeric, curcumin, garlic, other supplements. Honestly, during the Q&A, you guys may ask me about a supplement I've never heard of, and I'm a dietitian. So this just tells you how incredibly large the space is and how difficult it is, even for us that are practicing, dietitians or work in research in academia. It's hard for us to keep track of all these different supplements. So although, some of these, herbal supplements have been shown to kind of have an anti-inflammatory or antioxidant effects in small clinical trials or in animal models, unfortunately, larger randomized control trials typically don't show that they reduce the risk of stroke. Perhaps the more important issue, though, when we talk about herbal supplements is drug-nutrient interactions. So as several of the speakers have kind of highlighted today during their talks, patients may be on aspirin, warfarin, other anticoagulants, and so obviously combining some of these herbal supplements with these medications may increase your risk for bleeding. So it's always a good idea to obviously consult with your healthcare team before taking any sort of herbal supplements if you are on these medications. So, the more upbeat part of the talk is probably going to be this part of the talk. So I actually am very encouraged, and we actually discussed one of these articles at a journal club with Dr. Savitz a couple of months, maybe it was a couple of years ago, and I lose track of time. But so we've spent the first half of the talk specifically talking about supplements or vitamins in the context of preventing stroke. But obviously, a lot of patients also ask about cognition. They're concerned about primary prevention of stroke, or they may have had a stroke and now they're really interested in preserving memory or reducing their risk of cognitive decline over time. So, what can we do for these patients in terms of nutrition or vitamins or supplements to kind of help to preserve cognition as they age? So let's begin with one of the few areas where recent trials have generated genuine excitement, in my opinion, and that's multivitamins and cognitive function. So I alluded to this a little bit earlier, but unlike stroke prevention, there actually have been several large randomized controlled trials recently, including the Cosmos study, which reported modest improvements in global cognition among community-dwelling older adults taking a daily multivitamin. So this is great. I mean, I'll say this is great because, and I kind of have it at the bottom of the slide there, but this is a promising low-cost strategy for cognitive aging, because I'll tell you exactly what they used in the study, and this is not me endorsing the specific multivitamin, but they just used Centrum Silver. They gave them a daily Centrum Silver, and then they obviously looked at, and this was kind of an unexpected finding from the trial as well. The Centrum Silver, or the multivitamin, was kind of the control or comparison group. The Cosmos was actually more looking at a cacao supplement, which has antioxidant effects, so beneficial effects on, cardiovascular health and that sort of stuff. And they actually ended up finding unintentionally that the daily multivitamin actually improved global cognition over time in these older adults. So this is one study. We typically need several studies to confirm this initial finding, but I do think that there's obviously a lot of potential here. And as I say, this could be a really, Centrum Silver, you can buy an entire bottle for $10 or $15. So this could be a really practical solution to our aging population. So finally, when it comes to this space, we've traditionally viewed cognitive decline as a disease of the brain. Increasingly, however, we recognize that the brain and muscle health are closely connected. So you have this brain-muscle crosstalk, and I was really interested in Sean's talk. He spoke about some of the cell therapy and how different organs may obviously emit different substances, and they may cross the blood-brain barrier and exert positive effects. It's the same way with muscle, especially when it comes to exercise. When you exercise, you secrete something called myokines, and they're able to go across the blood-brain barrier and exert beneficial effects on the brain. And so I think one really area, at least for us, in our research world, we are really interested in this connection between frailty and mild cognitive decline in particular. Frailty and sarcopenia are both linked to cognitive decline, disability, and loss of independence in older adults. I think the UK Biobank data actually showed that patients who had frailty at baseline and were followed over time were 4 times more likely to have MCI or end up with Alzheimer's. So this tells you that maybe we need to be focusing on skeletal muscle as well when it comes to cognitive decline and aging of the brain as well. So why does this matter, for stroke care? So maintaining, muscle health supports mobility, rehabilitation, and functional independence, and emerging evidence suggests it may also contribute to healthy brain aging. So maintaining muscle health is as important throughout aging, but nutrition becomes even more critical, after you have a stroke in particular. So let's shift from preventing stroke to supporting recovery after stroke as well. So vitamin D deficiency is common after stroke. So we always say that it's really important to kind of at least do some sort of nutritional assessment after a patient has a stroke, just to kind of so you can actually address if they have any sort of nutritional deficiencies. And this is particularly common in older adults when you have reduced mobility, limited sunlight exposure, and poor nutritional status. And then it's something else that I'm not going to discuss too much today, but then you add in food insecurity as well. And so you have this, kind of vicious cycle that really leads to kind of, nutritional wasting, and then outcomes are impacted as well. So although vitamin D hasn't been shown to prevent recurrent stroke or consistently improve neurological recovery, recent rehab studies suggest supplementation may improve muscle health, balance, and physical function in patients who are deficient. So there's actually some really cool, stroke rehab studies with vitamin D supplementation where you don't necessarily have cognitive improvements initially, but you may have kind of, well, I shouldn't say there's this link. Obviously, they have improved balance, so you could make a case that that is a cognitive improvement. But functionally, they're doing a lot better when they do vitamin D. Now, these are very preliminary trials, and we need larger trials to confirm this. But it kind of just highlights again the importance between muscle brain kind of crosstalk as it pertains to this population. So for now, the message is simple. Screen for deficiency when appropriate, and treat patients who are deficient as part of the comprehensive stroke care. Okay, 2 more slides, and then you guys get to eat lunch. So, a lot of obviously negative, kind of findings overall when it comes to vitamins and supplements and risk for stroke. But the one thing that I did want to kind of highlight, though, is the good news is that while supplements have little or no proven benefit for stroke prevention, healthy dietary patterns, like, the slide that I'm showing up here, the figure that I'm showing up here, I should say. This is data from one of the largest randomized control trials ever done with nutrition in an at-risk population in Spain. And what they found is that in middle-aged and older adults with risk factors for cardiovascular disease, if they followed the Mediterranean diet and they were supplemented with extra virgin olive oil, or followed the Mediterranean diet and they were supplemented with mixed nuts, they had a roughly 30 to 45% lower risk of having a stroke at 5 years. So healthy dietary patterns do work, okay? Healthy dietary patterns absolutely do work. And, this is not just the Mediterranean diet, it's the DASH diet. There's also some preliminary data showing that adherence to the MIND diet may also be beneficial for cardiovascular disease risk reduction as well. And so this illustrates the important principle we've discussed throughout today's presentation. Overall dietary patterns have much stronger evidence for stroke prevention than individual vitamins or supplements. And then, I would be remiss if I also didn't just give a quick, comment about physical activity. I'm kind of a weird hybrid in that my background is both, nutrition and exercise science, but this figure highlights one of the most consistent findings in stroke prevention. As moderate to vigorous physical activity increases, stroke risk declines in a clear dose response fashion. And so just meeting the current physical activity guidelines of 150 minutes of moderate to vigorous physical activity minutes each week is associated about a 20 to 30% risk reduction for stroke, particularly ischemic stroke. Now, one thing that I always want to point out when I show this figure is if you look at this figure, the steepest part of the curve is actually going from no physical activity to any physical activity. So even getting 20 to 30 minutes a week has probably about a 10 to 15% reduction in risk. So people always kind of confuse this because they think of physical activity or exercise, oh, you got to do a ton of physical activity or exercise to lose weight. You do not have to do a lot of exercise to see improvements in cardiometabolic health and reduction in risk of stroke. So I wanted to finish the presentation on a really positive note. We know that diet and exercise does work for reduction in risk. We just know that vitamins and supplements, the evidence is a lot weaker, unfortunately. So this is just, my final kind of summary slide, and then I'll let you guys eat. But I'd like to leave you with 3 simple messages. So first, lifestyle and guideline-directed medical therapy remain the foundation of stroke prevention. Second, supplements should be used selectively to correct documented deficiencies or when supported by specific clinical indications, but they're not substitute for these proven kind of lifestyle or medical therapies. And then finally, when patients ask what they can do to reduce their stroke risk, the strongest evidence still points to healthy dietary patterns, regular physical activity, and optimal management of vascular risk factors. And obviously, working with your physician to discuss how to optimize your care. So lifestyle first, supplements when indicated, and then evidence always. So, yeah. And I will be at lunch as well, so you guys can ask me questions at lunch if you want as well, but happy to take any questions. Good.
Okay, well, we are right on time. So want to thank everybody for attending, for staying with us. For those of you online, for staying online. And we would love to hear suggestions from you all on